I'm Dr. Frita, and today I'm giving you 9 common medications and drugs that can cause kidney damage. Are you at risk? Do you ever take medicines for pain, fever, for infection? So medications are good in many ways, definitely. They help us to treat pain, to treat fever. They help us with infections. They help us to treat cancer. They're helpful in many ways. I prescribe medications. However, there are definitely medications that can lead to serious kidney damage and even the need for dialysis. Sure, some of these medications that are harmful to the kidneys are ones that you're purchasing over the counter. But guess what? Sometimes the medications can be being prescribed to you by your doctor. I know, that's scary. But that's the point in being your own advocate and collecting information from sources you trust. Today, we're going to talk about it. I'm going to let you know if some of the pain meds you're taking, the antibiotics, maybe even the chemotherapy could actually be damaging your kidneys and what to do about it. Keep watching. Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. I'm Dr. Frita. I'm a board certified kidney doctor, and I want you to please go ahead and like this video and subscribe to my channel so you'll be among the first to know when I release information. And let me tell you, I give you evidence-based medical information on this channel in a way that's easy to understand. And that's exactly what I'm about to do right now, because I'm giving you 9 common medications and drugs that can cause kidney damage, some of which you might actually be taking. In addition to the specific kidney health information I'm giving you today, I give lots of general health information on this channel. And in fact, I have a freebie for you. I want you to go ahead and download a free PDF. Click the link in my description. I'll give you 10 healthy habits for a better you and a better life. As you listen to this list I'm about to give you of the medications that can cause kidney damage, I want you to pay attention and tell me which ones surprise you. Put it in the comments below. I'm really interested in finding out. Number 1, non-steroidal anti-inflammatory drugs, or NSAIDs. Yes, I'm talking about some common pain medicines like ibuprofen, naproxen, aspirin. Raise your hand if you take these medications. Well, these meds are excellent for pain and for inflammation. Lots of people who are having sports injuries or arthritis or menstrual pain will take NSAIDs. It's very common. But what you may not know is that NSAIDs, in some cases, can actually cause kidney failure. And I've actually dialyzed patients as a kidney doctor because of NSAID nephropathy. In other words, patients who normally would not have had kidney failure have ended up on my dialysis machine just because they've taken too much ibuprofen. It's true. Now, I do want to say, I'm not demonizing NSAIDs. There are some people with very healthy kidneys who are very hydrated who can take NSAIDs as prescribed and be fine. However, if you are vulnerable or if you already have CKD, chronic kidney disease, then NSAIDs may not be for you, or certainly you may need to be careful with the dosage. So let's talk about it. The way that NSAIDs work, yes, they're anti-inflammatory, they help with pain, but they also can decrease the blood flow to your kidneys. And in doing that, they can decrease how your kidneys filter out excess toxins and excess waste. So what this can do is lead to an acute kidney injury or even a chronic kidney disease. It can cause you to have an increased serum creatinine, a decreased eGFR, or estimated glomerular filtration rate, and in some cases, it can even cause a chronic interstitial nephritis. NSAIDs can even cause an issue with the way that you get rid of excess fluid. It can lead to edema. So how do you know if you're someone whose kidneys may have been damaged by NSAIDs? Well, first off, you want to consult with your doctor. Find out what your kidney function is. Find out what your eGFR is, what your serum creatinine is. Find out if you have excess protein in your urine. Then talk about the dosages of NSAIDs you've been taking. Have you been taking high-dose ibuprofen, like 800 milligrams 3 times a day? Has your orthopedic doctor ordered you to do that? Well, it's possible that this is okay for you for the short term, but if you're doing it for more than 10 days, or if you're doing it regularly, especially if dehydrated, it could be causing an NSAID nephropathy or an NSAID kidney disease. Are you taking medications for more than 10 days for pain or more than 3 days for fever? If so, you could be at risk. Are you taking a combination of pills, like some of these powders that have aspirin, acetaminophen, and caffeine? Okay, are you someone who likes to chug down a powder for pain? If so, you could be damaging your kidneys. So what you want to do is, even for over-the-counter medications like NSAIDs, you want to consult with your doctor. You want to use the medication as prescribed, and you want to make sure that you are properly hydrated if taking NSAIDs. And if you are a person who already has vulnerable kidneys, or if you're taking another medication that can also damage your kidneys, then NSAIDs might not be for you. Oh, when it comes to aspirin, your doctor may have told you to take a low-dose aspirin, like an 81 milligram aspirin. If you're listening to this video, don't all of a sudden toss your aspirin to the side. Consult with your physician, because in most cases, the low-dose aspirin may not cause a problem. But if you're taking a high dose, or if you already have very vulnerable kidneys, then again, they might not be for you. 2, antibiotics. Now, I'm sure we've all taken antibiotics to help us with infections, right? If you've had a strep throat, or if you've had an infected wound of some sort, if you've had pneumonia, you've probably taken antibiotics. However, there are certain antibiotics and certain antibiotic doses which can cause harm to the kidneys. Specifically, there are certain antibiotics like gentamicin or vancomycin, or even certain antifungals that can cause kidney damage, especially when they're given IV and in the hospital, and if you already have compromised kidneys. How do you know? You have to be your own advocate or be your loved one's advocate. If you find out that you're being prescribed an antibiotic and you know that you have kidney disease, or if you're just concerned that you could be vulnerable, ask your doctor, can this antibiotic harm my kidney? And if the answer is yes, you want to find out alternatives or what you can do to prevent the damage. For some of the IV antibiotics given in the hospital, for example, like the vancomycin or maybe the gentamicin, there are teams that will go through and dose the medications in ways that are safe for the kidney, and they'll monitor the levels. But you want to make sure you ask these questions and be your own advocate. And then there are even antibiotics that can be given as an outpatient that can be harmful to the kidneys. One, Bactrim, and you know that's a common one. It's actually an excellent medication for preventing a lot of infections and being taken prophylactically, and certainly for treating infections. However, if you already have vulnerable kidneys, or if you're dehydrated, or if you have CKD, then something as simple as Bactrim can make your kidneys worse. Talk to your doctor. The Bactrim can increase your serum creatinine. Also, certain antiviral medications can cause crystals in the kidneys, which can lead to blockage and decreased kidney function. So if you're being treated for a virus, ask your doctor if the medication can harm your kidneys. And if so, again, see what you can do to prevent it. Make sure that you're well hydrated. Ask for the alternatives and ask if you need alternate dosing depending on your kidney function or if you have CKD. Oh, and yes, there are certain HIV medications that can cause kidney damage as well. Be sure to watch my YouTube video on CKD stages after you finish watching this video. Number 3, now this one might get you. ACE inhibitors, medications like lisinopril, enalapril, benazepril. Yes, these medications can cause kidney damage. Let me know in the comments if you've ever been prescribed an ACE inhibitor or if you're taking it. Now listen, again, I'm not demonizing ACE inhibitors. These are actually excellent medications for certain people. ACE inhibitors like the lisinopril can be good for your heart health, and even in early stages of kidney disease, especially diabetic nephropathy. Medications like the lisinopril, the benazepril, these medications can help to decrease the protein in your urine, which actually can be helpful for your kidney health. That's in the beginning, early stages of nephropathy. However, as the kidney disease progresses, or if you have certain blockages in your kidney arteries or in your kidney vasculature, or if you're dehydrated, if you have low blood volume, these ACE inhibitors can actually lead to kidney damage and kidney failure. It's true. So what do you do? If you're being prescribed an ACE inhibitor like the lisinopril, ask your doctor, okay, will this be helpful to my kidneys? In other words, is it an early stage? Do I have early diabetic nephropathy? And then say, will this be harmful? And here's one of the things you can do. Request that your doctor, if they're giving you lisinopril, request that they check your kidney function before giving you the ACE inhibitor and then 2 weeks after. If you have a marked or a significant decrease in your kidney function, then the ACE inhibitor might not be for you. And I would request that your doctor see if you have some type of a blockage in your kidney arteries. Do you have some type of a renal artery stenosis? That's very important. Also, if you already have advanced kidney disease like CKD3, CKD4, have that conversation. And actually, if you're not already seeing a kidney doctor, ask that your primary doctor refer you to a nephrologist like me, because we are able to go in and really have some great insight on which medications are helpful and which ones are harmful. Other things that the ACE inhibitors can do is that they can have a side effect of giving you a high potassium in your blood or hyperkalemia. And having high potassium can lead to serious heart problems like abnormal heart rhythms. It can even cause your heart to stop if you have super high potassium. And yes, all of these things can be side effects of ACE inhibitors. So again, ACE inhibitors can be wonderful blood pressure medicines. They can be heart protective, even kidney protective early on, but they can also cause your kidneys to have a perceived low blood volume. And for certain patients, they can lead to kidney damage. 4, diuretics. Now this is a big one. Water pills. Have any of you taken water pills? Yes. Water pills can be very helpful if you're someone who's got a lot of bloating or edema, or if you have heart failure, or even if you have lung disease where you have excess fluid in your lungs. Then these diuretics like furosemide or Lasix, hydrochlorothiazide, spironolactone even, these can be really helpful in getting rid of the excess fluid in your body. However, in some cases, these diuretics can lead to dehydration, which can lead to kidney damage or something called pre-renal azotemia. These diuretics can also possibly lead to more long-term kidney damage, even leading you to needing dialysis, especially if you're taking high-dose IV diuretics, and if you're taking them for a prolonged period of time where you've been dehydrated for a prolonged period of time. So it's important that you talk to your doctor about monitoring your kidney function. Sometimes it's a tricky balance. You don't want to have fluid overload. You don't want to stress your heart, especially if you have congestive heart failure. You don't want to have a shortness of breath if you have lung disease and you have too much fluid in your lungs. But you don't want to be over-diuresed or have too much of the water pill because, again, it can lead to kidney failure. So what you need to do is to have candid conversations with your doctor. If you're on a water pill, ask them how they're monitoring you. They should be checking your kidney function regularly with that BUN, with that creatinine, with the EGFR to make sure that the diuretics are not harmful to you. Also, you want to find out certain side effects. Certain diuretics can cause you to have high calcium in your blood or high blood sugar or high uric acid, specifically the hydrochlorothiazide. Talk to your doctor. Again, diuretics are important. I prescribe diuretics to my patients, even to some of my kidney patients, but it's important that you're being monitored by someone who knows what they're talking about. Because yes, diuretics, these water pills, in some cases, can lead to kidney damage. 5, angiotensin receptor blockers or ARBs. I'm talking about losartan, valsartan. Oh, do those sound familiar? They might, because these are very commonly prescribed blood pressure medications. Heart doctors love to prescribe them. Kidney doctors love to prescribe them. But you must beware because, again, they can cause kidney damage in some patients. So here's the thing. Some of you may have been prescribed an ACE inhibitor in the past. We already talked about those, like the lisinopril, but you may have developed a cough, okay? A really bad, annoying cough. So your doctor said, oh, you can't take the ACE inhibitor, take this ARB. So now they've prescribed you losartan, the cough is gone, you think everything is great. However, if you're someone who already has advanced kidney disease, or if you have a low blood volume and you're dehydrated, then it's possible that the ARBs can actually hasten the progression of your kidney disease. In other words, they can take kidneys that are already vulnerable and make them much worse and even send you into kidney failure. So if you're taking an angiotensin receptor blocker, an ARB like losartan or valsartan, talk to your doctor because In some cases, if your kidneys are vulnerable, it could cause you to have kidney failure. Remember, I'm not demonizing all of these medicines. Even I prescribe ACE inhibitors to certain patients. I prescribe angiotensin receptor blockers to some patients. But again, your kidneys must be monitored and you have to be your own advocate. Question, have you or anyone you know experienced kidney damage due to some of these medications or drugs I've mentioned? If so, please share your story in the comments. 6, chemotherapy agents. Now this is a big one because sometimes it's really a catch-22. If you have certain malignancies or certain cancers, then yes, the treatment of choice is also chemotherapy, but it must be balanced because certain agents like cisplatin, methotrexate can cause kidney damage, especially if your kidneys are already vulnerable. So when you're talking to your oncologist or the person who's prescribing you a chemotherapeutic agent, you want to A, make sure that they're monitoring your kidney function, B, make sure that you remain well hydrated, and C, ask for alternatives. There are oftentimes chemotherapy alternatives that may not be as nephrotoxic or poisonous to the kidneys as some. It's a balancing act. Life is a balancing act. But it's important that I at least make you aware that as a kidney doctor, I have seen patients who develop kidney failure and who even start to need dialysis because of the chemotherapy they're on. So it's important that you talk to an oncologist you trust, a physician you trust, find out all of the pros and cons of whatever chemotherapy you're on, find out if it's possible that it can cause kidney damage, and make sure that you're taking a chemotherapy or whatever treatment for your cancer where the benefits outweigh the risks. Because yes, some chemotherapy can lead to kidney damage. 7, imaging contrast dyes. Ooh, I can't tell you how many times I have been a physician in the hospital and I've been called to see a patient for a nephrology consult because they got contrast nephropathy. In other words, they've gone to get an imaging study like a CT scan with contrast and they developed kidney failure as a result. I've had to put patients on dialysis. Now, granted, most patients who get these CT scans, even with the IV contrast, most do fine. But again, there is a such thing as nephrotoxicity or poison to the kidneys caused by these IV iodine contrast dyes. Now, it's important to know if you're at risk. If you have perfectly healthy kidneys and you're very hydrated, then chances are you'll do pretty well with the IV contrast. And the radiology team, the radiologists, they actually do look at your kidney function before you're getting IV contrast. But as always, you want to be your own advocate and know your own kidney function so you can ask the right questions. If you're someone who has chronic kidney disease like CKD3, CKD4, or if you're someone who's very dehydrated, or if you're septic, or if you have a low blood volume, or if you're already taking one of these other medications I've mentioned that can cause kidney damage, then if you're getting an IV contrast dye, then it's possible that it can send you into kidney failure or at least cause kidney damage. You want to ask the questions. Don't be shy, be bold, be your own advocate. It is your right to ask your physicians questions. Here are some things you can do to prevent contrast dyes leading to kidney damage. 1, be very well hydrated. For most people, most adults, that might be 3/4 of a gallon of water a day, or 2 to 3 liters of water a day. Or if you're thinking about those 16-ounce bottles of water, that might be 4 to 6 bottles of water a day. Consult with your physician to find out how much water is safe for you to be well hydrated. Also, be sure to watch my video on the importance of drinking water for kidney health after you finish watching this video. Also, if you know that you really have to have the study or your doctor feels very strongly that the study with contrast is going to help your health or to help to make a proper diagnosis, then ask about receiving IV hydration, okay? Getting IV fluids through your vein intravenously. Getting the IV fluids before you receive the dye and after you receive the dye can oftentimes help to prevent contrast nephropathy, that kidney damage from the dye. In some cases, if you already have advanced kidney disease, but it really is imperative that you have the contrast dye, if it's really important that your doctor uses that dye, Then, in some cases, and I've done this before, you may actually have to have a temporary or a transient dialysis just to quickly get the dye out of your system. And in many cases, in most cases, when I've had to do that, the patients don't require long-term dialysis right away. The point is, again, you always want to arm yourself with knowledge. And that's the purpose of me sharing this information with you, so you can have these candid conversations. Because yes, IV contrast dye can lead to kidney damage. Oh, yes, there are alternatives. You want to ask, do I have to have contrast, or can I have a CT scan without contrast? Do I have to have contrast, or can we do something like an ultrasound, or can we do an MRI where that gadolinium can cause a different kind of a risk, in some cases a lower risk? Ask for the alternatives in imaging, okay? If it's suspected that you have a PE or pulmonary embolism, perhaps you can get a VQ scan instead of having contrast dye. Be your own advocate, talk to your physicians. 8, certain mood stabilizers can cause kidney damage. I can tell you this right now, as a kidney doctor, I have seen this time and time again throughout my career. So what do I mean by mood stabilizers? Well, patients with certain mental conditions, such as bipolar disorder, may need mood stabilizers, right? To help to balance them out, to keep them from being manic and to keep them from being super depressed, right? One of these mood stabilizers is lithium. And I have patients where lithium works really, really well for them to have a good quality of life and not to have these manic episodes or major depressive episodes. It helps to stabilize the mood. Well, one of the negative things about lithium is that it can cause kidney disease. It can cause thyroid disease in some patients as well. So it's important that the dose is monitored. And if you're a patient who's taking it, or if you have a loved one who's taking the lithium, you want to make sure that that kidney function is measured on a regular basis. Don't just be on the lithium and have your psychiatrist to keep increasing the dose without checking that BUN, that creatinine, the EGFR. What are the alternatives? Well, this is what I do with my patients. Sometimes if they're on lithium and it's starting to cause kidney disease, the first thing I'll do is find out from the mental health care provider, the psychiatrist, if there is an alternative, because lithium is not the only mood stabilizer. And oftentimes when my patients have kidney disease from lithium, we really can find other mood stabilizers that are not harmful to the kidneys. So that's a pretty good solution. But I have some patients where the lithium is really the only thing that works well for them. And we've tried other mood stabilizers, and with them, they may hit a major depression or even hit manic episodes that cause them to not really function well in society and not have good quality of life. In those patients, I oftentimes have to really lower the dose of lithium, make sure they're well hydrated, make sure they maintain good blood sugar levels, make sure they maintain good blood pressure levels. And sometimes we have to have another mood stabilizer in conjunction with the lithium so we can have the lowest, safest amount. The point is that if you're taking a mood stabilizer, specifically lithium, again, be your own advocate, because lithium, in some cases, can cause kidney damage. 9, alcohol and illicit drugs can cause kidney damage. For the alcohol, if it's taken in excessive amounts especially, it can lead to hypertension, which is the number 2 cause of kidney failure. And then illicit drugs like cocaine, heroin, other drugs as well can lead to kidney failure. Okay, let's just take the cocaine. The cocaine can cause your blood vessels to tighten or to constrict, and they can cause you to have a severely decreased blood flow to your kidneys, which can lead to kidney failure. Also, that cocaine can lead to very high blood pressure, dangerously high blood pressure, which can lead to kidney failure. I've had patients on dialysis and who've needed transplants only because of the cocaine. Heroin as well. Heroin can cause kidney failure for many reasons. Well, one of the reasons is that it can be mixed in talc and other substances that are actually nephrotoxic. So there are many reasons why you should not indulge in illicit drugs and excess alcohol. But let's just add this to the list, because alcohol and illicit drugs can cause kidney damage. These are just some of the medications and drugs that can cause kidney damage. Again, we know that medications can be very helpful, and even some of the medications on my list are ones that I prescribe to the right patient. But it's important that you at least understand that some of these medications can lead to kidney failure so that you can protect yourself and your loved ones. If you found this video to be helpful and informative, Please be sure to share it with the people you care about, and make sure you like this video and subscribe to my channel and hit that notification button so you'll be among the first to know when I release new videos. I appreciate your support, and as always, I want you to do your best to live your healthiest, happiest life. I'm Dr. Frita.